Good afternoon, my dear students. It is time to start our lecture, and I hope, as usual, only clever students come to the internet and are ready for education, for anatomical education. Okay, now the traditional question: how do you hear me? Clearly or not? If not clearly, I will be very sad. Tell me, please, what is the connection? How you estimate it? Everything is well? Hello? Yes, thank you. And today's topic is venous systems. And we will, in the end of our lecture, we will talk about fetal circulation. As you probably know, veins are regarded as the capacity sense vessels of the cardiovascular systems. That is a large part of the cardiovascular system, because veins are relatively thin-walled and flaccid vessels. It means the wall of the veins are thinner than in arteries, and veins expand easily to accommodate an increased volume of blood. That is, veins have a greater capacity for blood containment than arteries do. As we were talking about last lecture, maybe you remember that, about 64% of the blood in our body is found in the systemic veins, and only 13% in the systemic arteries. Of course, systemic circuit, not pulmonary, not small circuit, only systemic, big, large circuit or large circuit circulation system in our body. And now is time to study more about veins. What kind of feature they have, and we will talk about some big or large in other words, systemic veins in the human body, which we call superior vena cava system, inferior vena cava system, portal vena system, and this fourth system in the body is the veins of the heart, or another name is coronal sinus systems. We will talk in the end. I'll tell you about fetal circulation and what happens after birth. And we start from the general characteristic of the venous system. The main idea that the vein collect blood from all tissue and organs, and they return blood to the heart. As we trace blood flow in the arteries, we find it splitting off repeatedly into smaller and smaller branches, One artery is splitting on 2 or 3 branches, and then another splitting and another splitting. But in the venous systems, conversely, we find small veins merging to form larger and larger veins as they approach to the heart. All veins come to the heart because veins are, as we decided last lecture, veins are blood vessels what transport blood to the heart. Arteries transport from the heart, but veins transport to the heart. And we refer to the smaller veins as tributaries by analogy to the streams that converge and act as the tributaries to rivers. It is the same analogy like in rivers. Rivers have the tributaries, and veins also have tributaries. In the end, all rivers come to the sea, and all veins come to the heart. That is the main idea. If we take a look into histological structure, in the histological picture of the veins, we could find that arteries and veins have different organization of the vessel wall. The walls of arteries are thicker than those of veins. It is visible. Here is the artery. Here, artery. This is the artery, and you see the wall of artery is usually thicker than the veins wall, the wall of the vein. The media of an artery contains the tunica media here, and usually this layer contains more smooth muscles and elastic fibers than a vein. Here, the vein and this layer of the veins wall has less smooth muscles. Another difference is the vessel lumen. Lumen is the what does it mean? The lumen. Lumen is the gap or the space inside of vessel. Here is a lumen of the veins, and here is the lumen of the artery. And it is very easy to see. It is nicely see that the veins lumen is bigger than the neighbor's arteries. That the artery is located near the veins. Another interesting fact is that the wall of an artery will contract, and it constrict the lumen. It is visible. Therefore, when viewed during dissection or in a sectional view like it is here, the lumen of an artery appears smaller than an accompanying vein. And because arterial walls are thicker and stronger, they retain their circular shape in histological section. In contrast, cut veins collapse, and in histological section they often look flattened or distorted, like here. Artery are circle, but the vein is like a pancake, let me tell that. And vessel lining, another difference we could find here, that is the endothelial lining. I mean the internal lining in the artery, in the vein. In the vein here is the internal dark blue internal layer of artery, and here is a little bit light blue, or the internal layer in the vein. And you can nicely see the difference. The endothelial lining of an artery cannot contract, and it has endothelial folds, a lot of folds visible in the artery, inside of artery. But veins, the lining of veins lack these folds. It is flat. It is only flat. And the fourth difference are valves. Only veins typically have valves. That internal structures inside of vein, usually valves located in the vein of the lower extremities. No valves in the head, no valves in the neck, but in the lower extremities, sometimes in the upper extremities, we could find there. This is a structure. Valves are a structure that help. They help blood to flow only one direction, and they prevent the backflow. How do they work? It is open walls, and here the this valve is closed. Open and close is only two position for veins walls. And some kind of function. What kind of function the veins have in the? What kind of function they carry out? They transport blood from capillaries to the heart. That is, I think it is very easy to understand. And they deposit our blood, and sometimes it is from 2 to 3 times greater than blood in the arteries, because veins have greater diameter than arteries. Veins regulate blood circulation in organ and they regulated in optimal level. It is because vein contain smooth muscles in the wall, and contract of these muscles regulate blood circulation in special organ. Interesting fact, it is number 4, that veins collect all lymph in our body. Only veins take lymph, and this is two place. It is in the neck region, where all lymph vessels come and empty into veins. Veins also have the receptors, and some of them serve as receptor organs. This is a chemoreceptor, baroreceptor, that they regulate pressure, blood pressure, and some of them regulate asthmatic pressure. This is a pressure what is done by the special chemicals, usually proteins solved in the blood. And also the veins, they absorb proteins, carbohydrates and mineral salts, because the small veins are part of microcirculatory beds. We talked about microcirculatory beds last lecture. That is the distal part of microcirculatory bed for micro vessels in our body. We usually have interest to the factors what help the blood to flow, and this is some factors usually what venous vessels has. Why blood? Why do the blood flow to the heart? Why vein transport the blood? There are four factors. First is of course it is the action of the heart. This is a pumping action, and heart produced pressure, and this pressure is also present in the veins. Then that is the skeletal muscle contraction. Skeletal muscle contraction is visible this picture. When muscles contract, they press veins, and it helps blood to flow in veins. And walls, of course, are factors. Here is visible walls, here and here. Not possible flowing back, flowing distal, only to the heart direction. And also pulsing of arteries. It is a small factor, but it is also present here. When arteries pulsing, like it is visible here, This is a bigger diameter, and it helps in accompanying veins to transport blood. And the last one factors, but it is not the least factor, that is the respiratory pump. What does it mean? When we breathe, the inside of our thorax we have negative pressure, and this is a negative pressure helps helps large vein, especially located in the thorax. This negative pressure helps blood to flow in these large veins. This is a clinical interesting fact that sometimes valves in lower limb, commonly this is a situation we observe in the lower limb veins. When this is a two picture. Normal, here is normal valve when blood flow is typical, and here is this is some kind of varicose vein when the valve is bigger, and it doesn't work properly, and blood come back. It make veins diluted and not diluted, but enlarge, and this is also visible under the skin. Here is a noodle, we call it a noodle or varicose vein. First of all, it is not good, but when it happens in people who stand for long periods, such as barbers and cashiers, blood tends to pool in the lower limb and stretch the veins. This is especially true of superficial veins, which are not surrounded by supportive tissue. Stretching pulls the cusps of the venous valves further apart until the valves become incapable of filling the vessels and preventing the backflow of blood. As the veins become further distended, their walls grow weak, and they developed into varicose veins with irregular dilation and twisted pathway, like it is visible here. It is a twisted pathway, and of course that is a dilation. That is a big diameter of the superficial veins. The obesity and pregnancy also promote development of varicose veins by putting pressure on large veins of the pelvic region and obstructing drainage from the lower limbs. Varicose veins sometimes developed because of the hereditary weakness of the valves. It means that the connective tissue inside of valves is different, and that is a hereditary. The case is in the genome of our genome. We with the less drainage of blood tissue of the leg and foot may become edematous and painful. That is typical for people after 40, sometimes after 50, and usually this is the only way to cut the skin in surgery operation and dilute this enlarged varicose vein. Sometimes doctors use conservative therapy or conservative treatment this disease, but more effective is surgery operation. And another hard situation, this is a dramatic situation, when inside of such a dilated veins we find thrombosis, like it is visible here. Because of the turbulent flow, and it happens that small aggregation, small erythrocyte aggregation start in the walls, then it became bigger and bigger, and in the end that is a big thrombus. Why I said that is a dramatic situation, because such as a red thrombus can go proximal, come to the heart, and then from the right ventricle it comes into the lung arteries. And no way this is red thrombus. This is a red thrombus produce it stop circulation through the lung, and that is a really dramatic situation when people may die. Some couple of words I'd like to tell you about feature of vein structure. First of all, I'd like to show you the distinguish between superficial and deep veins. Here in the light blue color we see superficial veins. Here is brachialic and cephalic veins, and in the dark blue color we can see deep veins here. Deep veins is subclavian, axillary, brachial, and a lot of veins in the abdominal cavity and thoracic cavity, as well as in the lower limb here. This is the deep veins, and also we could find superficial veins in the lower limb as well as in the upper limb. It is a difference from arteries, because we could not find superficial arteries. They always are located deep together with the deep veins, but only superficial veins visible under the skin. And usually doctors and nurse use these superficial veins to inject medicaments or drugs. I mean drugs, not like a narcotic, but only like a medicine substances in the superficial veins. Deep veins accompanying the arteries and usually together with the nerves. Nerves, arteries, and lymphatic vessels come together and they formate neurovascular bundles. Only deep veins and deep lymphatic vessels and arteries and nerve form this structure called neurovascular bundles. The interesting fact that some organs have plexus, venous plexus, mainly organs in abdominal cavity, a lot of organs in the pelvis region, like uterus, rectum, bladder, have venous plexus. It is a combination of different veins, small and big, and they surround organ and called internal organ venous plexus. And interesting that in cranial cavity there where located brain. The brain has special venous special devices. Special devices called venous sinuses. Venous sinuses. This is the they produce from they made from the dura mater. This is inside of brain. We have thick layer of connective tissue, and this is protect the brain, and also it contains venous sinuses. Here visible some of these sinuses. This is a cavernous sinuses, and here is the sigmoid sinuses, transverse sinuses, straight sinuses, and etc. I will tell you. This is sinuses provide an unobstructed flow of blood from the cranial cavity to the extracranial vein, because our brain is very sensitive to the circulation disturb, to the circulation when it stopped because of vein very easy to press. The wall is thin, not like in artery. So in brain, this is a special devices help to flow blood from the brain to the extracranial veins. Vein classification. This is the first of all, we distinguish two big system of the vein. Systemic veins, they are in the systemic ciocardia, and the pulmonary veins. Here is visible pulmonary veins 1, 2, 3, and 4. Usually, every lung has two pulmonary veins, and all of pulmonary veins come into the left atrium. This is the end point of pulmonary ciocardia. So, when we talk about system, vein system in the body, we mean two big systems. Systemic veins in the systemic circuit and pulmonary veins in the pulmonary circuit. I hope that is easy to understand. Here is the vein classification. We distinguish veins by the site. Small veins, usually these veins receive blood from the venulus in the microcirculatory bed. They are up to 1 millimeter in diameter, only 1 millimeter, not more. And they have a tunica media of 1 or 2 layers of smooth muscles and a thin tunica externa. Medium veins range up to 10 millimeter if it is 1 millimeter in diameter. Medium veins usually have up to 10 millimeter in diameter, not more. Most veins with individual names in our body are in this category, such as the radial and ulnar veins of the forearm and the small and great saphenous vein of the leg. Medium veins have a tunica interna with an endothelium, basement membrane, loose connective tissue, and sometimes a thin internal elastic lamina. The tunica media is much thinner than it is in the medium arteries. It exhibits bundles of smooth muscles, but not a continuous muscular layers as seen in the arteries. The tunica externa is relatively thick for this group, for medium veins. As I told you, venous sinuses are veins with especially thin walls, large lumen, and no smooth muscles in the wall. Examples include the coronary sinus of the heart and, of course, the dural sinuses I talked before. That is in the brain, in the cranial cavity. Unlike other veins, they are not capable of vasoconstriction. No constriction for venosus, only flow, only easy flow for the blood flow. And the fourth group is large. Here is large, or we call sometimes them systemic veins. They have diameter greater than 10 millimeters, more than 10 millimeters. And it is not easy to write. These large veins have some smooth muscles in all three tunic or 3 layers of the wall. They have a relatively thin tunica media with only a moderate amount of smooth muscles. The tunica externa is the thickest layer and contains longitudinal bundles of smooth muscles. Large veins include the vena cava, pulmonary veins, internal jugular veins, and of course renal veins. That is the systemic veins. And we distinguish four systemic veins. Usually this is only 4, except exact pulmonary. We will not talk about pulmonary veins today more, and only for systemic veins means the systemic succut. First systemic veins is the superior vena cava. Here is the superior vena cava. It formed from the brachiocephalic veins, collected blood from neck, from head, from upper limb and chest, and it is empty into the right atrium. The second systemic veins is inferior vena cava. It is here. Formed from the common iliac veins, right and left, and it collects blood from the lower limb, from lower extremities, in other words, small pelvis organ, all organs of the abdominal cavity and liver. And as well as the superior vena cava, it empties into the right atrium. Portal vein system formed from the splenic veins, superior and inferior mesenteric veins. It collects blood from unpaired abdominal organ to the liver. Here is a big and very well known portal vein. Come into the porta of Hepatis. This is the gap on the lower surface of the or visceral surface of the liver. And the fourth system is the coronal sinus system. This is a coronal sinus here. It formed from the large vein of the heart and collect blood into the empties into the right atrium and collects blood from the all heart veins. Next is the information about superior vena cava system. Superior vena cava system, that is one of the biggest venous system in our body. And as you see, superior vena cava is quite short vessels, only up to 8 centimeters long, but the diameter is large, 21-25 millimeter. It is formed by fusion of the right and left brachiocephalic veins. Here is the name, brachiocephalic veins. Usually students have no idea where these big veins are located in our body. It is very easy. It is in the upper mediastinum, inside or into the chest, up to the heart, and it is visible how they form and like tributaries. They are tributaries of vena cava superior, and they call brachiocephalic veins. Please don't forget this fact. And the superior vena cava receive blood from thoracic and abdominal wall because they have only one only one in tributaries, except brachiocephalic veins, and it come blood from the abdominal wall. Of course, that is the collector for the blood from head and neck organ and from upper limb. Here visible veins from upper limb, and here veins from head and neck organs. The tributary, the only tributary for superior vena cava is azygos vein. That is a small vein, come here usually from thoracic cavity, and before superior vena cava empties into the right atrium, that is a small tributary we call azygos vein. Brachiocephalic veins are formed from internal jugular and subclavian veins. Their tributary are internal thoracic, lower thyroid, thymic, and mediastinal veins. A lot of small veins come into brachiocephalic vein, and they are tributary of that vein. In the neck and in the head region, we have three big, quite big veins we call jugular. Sometimes the pronunciation is jugular, but I think jugular is the same as Latin. And this is three. There are three jugular veins in the neck. The biggest one is internal jugular vein. The second is external jugular vein. Here, this is a Latin term, vena jugularis externa. Here, internal jugular vein or vena jugularis interna, and we also can find the small vena jugularis anterior or anterior jugular veins here. So 1, 2, and 3 veins we find in the neck region. The biggest one is the internal jugular veins. This is a large vessel, and it collects blood. It collects blood from brain, from face, from neck, for inner ear, from eyes, and from intraosseous veins. So that is a real big and systematic veins in our body. If we press the veins, jugular veins, it is difficult, and the brain will extra flow. The blood will not come from the brain, and that is difficult. The people can die. I told you that brain has special devices. We call them sinuses, and they are located in the dura mater. Here is the dura mater. It has some special structure, a special plates, and we call them falx cerebri and tentorium of cerebelli. Inside of this structure are sinuses are located, and it is visible superior sagittal sinus here is, and inferior sagittal sinuses, direct or straight sinuses, transverse sinuses, cavernosus sinuses, and the biggest one is the sigmoid sinuses. Usually all of these sinuses they collect blood from the brain veins, and they transport the blood to the internal jugular veins. The internal jugular veins start from the foramen jugularis interna, where sigmoid sinuses end. So that is the place when all blood from the brain come into the internal jugular veins. Another sinuses I'd like to show you is the peterosus, inferior or superior sinuses. They come near to the pyramid of the temporal bone, and they also empty into the either sigmoid sinuses and to internal jugular vein. This is the superior sagittal. This is another projection, another picture. We see superior sagittal sinuses, transversus sinuses. It follow in the sigmoid sinus, and here visible internal jugular vein. We know this return from upper limb. This is a lot of small veins in the hand, and these veins are called digital veins. They empty into the superficial and deep palmar veins of the hand, visible superficial because they are light blue, and the deep palmar veins, they are dark, they have dark blue color, and they have interconnection and form venous arches. This is usually these venous arches located on the dorsal surface of the hand. If you take a look and see the dorsal surface of your hand, you see a lot of veins, especially for men it is visible, and these veins are large and form dorsal venosus plexus or net. And from that net start superficial veins, that is the basilic veins located medial, and cephalic veins located lateral. All of these come into the brachial or in the axillary veins. And visible also deep veins of the upper extremity, and these deep veins accompanied arteries and nerves, and located deep. Next systems I'd like to talk about. This is the inferior vena cava system, and this systems it transports blood from the lower part of our body, usually from the abdomen, from liver, from lower limb, and this is the that is the thickest, the diameter of inferior vena cava is the biggest, usually up to 30 millimeters in diameter. It is formed from right and left common iliac veins, and this is a level of between 4 and 5 lumbar vertebra. Here is a point of formation, point for inferior vena cava. The blood come into the vena cava from the organs, from the kidneys, from the liver, from the muscles of abdomen muscles, and as well as from the muscles, joints and bones of the lower limbs. It has parietal tributaries. They located in the walls of the abdominal cavity, and it is also visceral tributaries. That is, the veins come from the kidneys, suprarenal glands, and some organs of pelvic cavity, uterus, rectum, and prostata, and blood, and urinal blood. Not from I'm sorry. Hello? Да, здравствуйте. Людмила Арсентьевна, I'm very surprised. Я сейчас читаю лекцию для англичан. Можете мне перезвонить где-то через час? Я закончу как раз лекцию. Хорошо? Да, пожалуйста. Да. До свидания. I'm sorry. It was call from United States of America. I was very surprised. It is my colleague who live St. Petersburg, who lived in St. Petersburg, and now she is in New York City. Okay, coming back to our lecture, and that is the visceral tributaries of the inferior vena cava, and that is some organs, not all, but some organs, including the testes, internal and external sexual organs, rectum, but visceral tributaries, it is there are no tributaries from abdominal organs such as the stomach, intestinal tenue, like pancreas, duodenum, because all blood from these organs come into the portal system. We will talk about later. Iliac veins, we have common iliac veins here, and internal and external iliac veins. Internal iliac veins collects blood from the pelvic organs, but external iliac veins transport blood from lower limb. And here visible lower limb veins, as well as for upper extremity. We could find superficial here superficial is dark. I'm sorry, this is not my picture, but now the superficial veins have a dark blue color, but deep veins drawn here with a light blue color. But the same idea. Each lower extremity has got superficial and deep veins. Superficial veins called vena saphina magna or great, and vena saphina parva or small sapphine vein. And the third is a portal vein system. It is interesting system because it is not possible for the blood from the abdominal organ, mostly abdominal organ like stomach, pancreas, spleen, colon ascendens, transversus, and the small intestine. All blood from this organ come into the portal system. Hepatic portal system begins in the capillaries of the digestive organ and ends in the liver sinusoids. The liver is the only digestive organ draining directly into the inferior vena cava. Here is a drainageous vein we call hepatic vein, and they empty into the vena cava, not from abdominal organ. Only liver systems, only liver vein are tributaries of the inferior vena cava, and blood leaving the capillary beds from the abdominal organ, supplied by the celiac trunk, superior mesenteric and inferior mesenteric arteries, flow into the veins of the hepatic portal system instead of traveling directly to the inferior vena cava. As we mentioned before, a blood vessels connecting two capillary beds is called a portal vessels, and the network is a portal system. Blood flowing in the hepatic portal system is quite different from blood in other system veins because it contains substances absorbed from the stomach and intestines. For example, levels of blood glucose and amino acid in the hepatic portal veins often exceed those found anywhere else in the cardiovascular system. The hepatic portal system delivers these and other absorbed compounds directly to the liver for storage, metabolic conversion, or excretion. The largest vessel of the hepatic portal system is the hepatic portal vein. Here, hepatic portal vein. Here, this is the name, hepatic portal vein. And it delivers venous blood to the liver. Portal vein receives blood from the three large veins draining organs within the peritoneal cavity. Three veins. What kind of veins? This first is the superior mesenteric veins, and its tributary, it is here. As you see, superior mesenteric vein collects blood from veins draining the stomach, right gastroepiploic vein and other, the small intestine, and 2/3 of the large intestine. Usually this is a cecum, ascending colon, and a half of the transverse colon. The next tributaries of the portal vein is the splenic vein and its tributary. The splenic vein collects blood from the inferior mesenteric vein. Usually, sometimes inferior mesenteric vein collect empty into the spleen vein, but sometimes they have a different direction. And usually it collects blood from lateral border of the stomach and pancreas. And inferior mesenteric vein collect blood from capillaries in the inferior portion of the large intestine. The left colic vein and the superior rectal veins, which drain the descending colon, sigmoid colon, and rectum, empty into the inferior mesenteric vein. And I'm very sorry, Юрий Александрович, лекцию на английском читаю. Я закончу, позвоню. Окей? Ну, минут через 30, не раньше. А что тебе, что-то срочное? На гистологию? Слушай, надо, а как его фамилия? Что за человек? Да. Угу. 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 Кандидатской нет пока, да? У него? Ну, да. Юрий Александрович, спасибо. Он живет в Петербурге и собирается жить дальше. Да. Дай ему мой телефон, если можно. Я с ним переговорю, назначу ему встречу, побеседую, а потом посмотрим. В общем, я за предварительно. Ну, там, конечно, у нас вот с этим-то не очень. Просто тут, увы... Ну, старший лаборант это где-то 1015-17. Ну, можно там доплачивать ему чуть-чуть, еще там 5-8. Ну, вот это все, что я могу предложить на первый год-полтора. Unfortunately, да. Юрий Александрович, тебе тебе наградят за то, что ты так заботишься. Тебя возьмут потом на штат в управление кадров, я уверяю. Тебя, да. Спасибо. Я сейчас закончу лекцию, тогда пусть мне перезвонит попозже. Хорошо? Все, спасибо. Да, давай, пока. Sorry, it was important call for me. And as I told you, three sources, three tributaries of the hepatic portal system is the superior mesenteric vein, splenic vein, and inferior mesenteric vein. The circulatory system of the liver is very special because there are three blood streams in the liver. First is arterial. This is the red vessels here. This is the portal bloodstream. This is the biggest blood vessels in the liver. And the third is the hepatic veins. It is not green, it is this light blue color. Here is usually 3-4 hepatic veins which come into the inferior vena cava, and this is necessary because a lot of toxic substances come from the digestive organs, and if they come directly to the inferior vena cava, it was very danger for life, for human, because this is toxic substances. We would kill people in 20 minutes. A lot of toxic substances produced by microorganisms in our intestine. That is the bacteria, and they produce some toxic substances, and it was difficult. It was very dangerous if these substances come in the systemic cut. So liver detoxicate and it combine some other substances and inactivate toxic substances and let them come into metabolism. So that is a very important role of our liver. Here is the scheme of or diagram liver blood supply, where is vena porta, first one, arteria hepatica propria, and they come into the capillaries, we call sinusoids, and then from 2 to 4 hepatic veins come into the vena cava inferior. That is the combination. And as I told before, the presence in the liver specific large diameter capillars, sinusoid. Марина Сергеевна, читаю лекцию, перезвоню, ладно? Угу. Хорошо. Угу. And this large diameter capillars we call sinusoid. Here is the sinusoids, and sometimes we call them retimirabile venosus, because the arterial blood come in this sinusoid, and venous blood from the portal system. So it's a mixed blood, and as a result they produce central vein in the hepatic lobulus, and all blood from the central veins from the lobulus come into the hepatic veins and then into the inferior vena cava. We distinguish some kind of anastomosis between portal system and superior and inferior cava systems, and we call them portocaval anastomosis. Sorry, this is a Russian name, and this is anastomosis sometimes located in the esophagus, and when portal systems stop by the cirrhosis, like when pathological process stop or decrease blood flow in the portal system, the anastomosis open and form this varicoses esophageal veins. And sometimes we find this anastomosis not in the esophagus, but it is visible on the anterior wall of abdominal cavity. We call them Medusa's head because it is like a head and hair, snake hair in Medusa gorgona. This is a Greek mythic creation. She has human face, but hair was instead of hair she had snakes. And this veins in the located in the on the surface of the abdominal cavity, also called Medusa's head. The fourth system, it is the coronal sinus systems, and this is 5 veins, 5 cordial or hot veins. They come into the coronal sinuses, or sinus coronaris in Latin, and the blood. It is a small system, but all blood from the heart come into the right atrium through the coronal sinus systems. And the last part of our lecture, this is a fetus circulation. I'd like to show you as the picture where visible placental circulation. There are significant differences between the fetal and adult cardiovascular systems. This difference reflects the different sources of respiratory and nutritional support. The fetal lungs are collapsed and non-functional, so the digestive tract has nothing to digest. The placenta is an organ located in the uterus of mother uterus. This is a complex organ regulating the exchange between the fetal and maternal blood streams. Provides all fetal respiratory and nutritional needs. 2 umbilical arteries, here is visible 2 umbilical arteries. Take into consideration that they are blue because they contain deoxygenate blood. 2 umbilical arteries branch of the internal iliac arteries of the fetus. These vessels enter the umbilical cord and deliver blood to the placenta. Arteries deliver blood to placenta. Blood returns to the fetus from the placenta in the single umbilical veins. Here is the umbilical veins, and it is drawn with a red color because it contains oxygenate blood. As well, except oxygen, it contains some nutrients that come from the mother's vessels into placenta. So it's a change. Placenta is a place where oxygen change to the carbohydrate, and also it provide fetus with the nutritions for metabolic for the metabolic reactions. And this is a difference, the main difference fetal and for fetal, and this is a difference from adult cardiovascular systems. And also the after birth, during the fetus circulation, we could find special vessels like ductus venosus between umbilical vein and vena cava inferior. We could find also ductus arteriosus. Usually we call them Botalov ductus, and we have opening oval foramen between right and left atrium. This is dramatically changes when the fetus birth, after birth, and this with a newborn first breath, lung start to breathe, gastrointestinal activity and circulatory patterns change, and this visible next picture at birth dramatic this is visible in the body, in the child body, and as well as inside of the heart. When the infant takes its first breath, the lungs and pulmonary vessels expand. The smooth muscles in the duct arteriosus here, duct arteriosus, is contract, and this isolates the pulmonary and aortic trunks. So it is isolated pulmonary circuit and systemic circuit. So start two systemic, pulmonary and large, or systemic, big. As pressure rises in the left atrium, the valvular flap closes and the foramen ovale and completes the cardiovascular remodeling. In adult, the intraseptum bears a shell of depression, the fossa ovalis making the site of the original foramen ovale, and remains of the duct arteriosus remains as a fibrous cord, the ligament arteriosus. And if the proper circulation changes do not occur at the birth or shortly thereafter, problems will eventually develop, like congenital diseases, and they needs a surgery operation. Sometimes the treatment is easy, sometimes it involves longer surgical closure of foramen ovale and the ductus arteriosus, or both. Other forms of congenital heart defects, I informed you about these defects during our lecture about heart. It was 2 weeks ago, and I hope that it happened sometimes, but not very often. And with that information, I'd like to stop my talking and ask about questions. If you have questions, please put it. I see. About previous lecture test, I don't want to give you test for arteries and veins, and I hope I give you a small test when we pass the last lecture this June, and it will be test. Don't worry about that. Just enough you present at the lecture, and I hope we don't need the test. Any other questions, please? no questions. So let me finish this lecture and wish you good day, and hope to see you 29th June. It will be 2 weeks ago. Well, thank you for warm words, and see you next time. Bye bye.